Welcome everybody. My name is Dr. Louise McBride. I am the Head of Department of Nursing and Healthcare here at Letterkenny Institute of Technology. We are going to share our programs that we deliver here in the Department of Nursing and Healthcare. So the first program is the Bachelor Honours Degree in General Nursing. As you can see, this is actually 31 places and it leads to a registration in General Nursing. Our second program is the Honours Degree Bachelors in Psychiatric Nursing. In this program, we have 32 places, but this is aligned across two separate mental health services in the Northwest. 16 places are aligned with Donegal Mental Health Services, and 16 are aligned with Sligo Leitrim Mental Health Services. The third honours degree is a Bachelor Honours Degree in Intellectual Disability Nursing, and this has 20 places through the CAO. I just want to draw your attention to the minimum entry requirements that you'll see in the prospectus, but in particular the maths, which needs a minimum of an O6 or a H7, and it also needs a science subject, whether that's physics, chemistry, combined biology or ag science, and the minimum there is a 06 or a 07 or a H7. It's important to note that our degree in nursing is actually delivered in partnership with our HSE partners. So we have a memorandum of understanding, and this is very important so you can fulfill your clinical placements as part of the 4-year degree programme. Another important aspect to highlight to you is that Garda vetting is essential. We ensure that all of our student nurses do mandatory training, and we also ensure that there's a health declaration. But more details with regards to this can be seen in the prospects. The other important item to flag with you is that it is a combination of theory and placements over the 4 years, which is a full-time honours degree programme. From year 1 to 3, you are what we call a supernumerary student. And this basically means that when you're in placement, you are supervised under the direct guidance and supervision of a registered nurse, be that in general, psychiatry or intellectual disability. In 4th year, there is an internship. The good news is that this internship is actually a paid internship for 36 weeks, and that runs from January of your final year until the end of August. The most important thing to flag here is that your qualification in nursing at the end of 4 years is a dual qualification. Not only will you have a primary honours degree in your relevant discipline, but you will also be accredited and on a register with the Nursing and Midwifery Board of Ireland as a registered nurse. So I've mentioned the placements in the Northwest. So this is just to give you an idea of where, as a discipline, you might spend your placements, because students like to know where they will spend their placements across the 4 years. So as you can see here in general nursing, predominantly most of your placements will be done in the Letterkenny University Hospital, here based in Letterkenny. But we also have community-based settings, care of the older person settings, primary care setting, including the public health nurse. In psychiatry, as I've mentioned, it's split over Donegal and Sligo Mental Health Services, 16 in each. So it's a combination of the acute approved centres in both of these areas and also specialist settings, including recovery, community, mental health, and so on. But also the psychiatry nurses do have to do a small placement, a short placement in the acute general setting also. The final one there is the intellectual disability clinical placements. Again, an array of different services throughout the Donegal catchment area, all taking on board some full-time residential, day services and specialist settings also. So general nursing is by far possibly the most popular of the three in terms of applications, but equally opportunities in the other disciplines also. So this will just give you an insight as to the different subjects areas that you'll be covering. So you do nursing skills, which are the fundamentals, including blood pressure, temperature, pulse. There's also skills of oral hygiene, catheterization, bed making. But you can see there's lots of other very interesting subject areas, more detail obviously in the prospectus for these courses, but you do biology and related science, you do social and behavioural, which includes sociology, psychology, professional and ethical nursing incorporates law, ethics, and then of course the clinical nursing pathways, which are very much specialist, including medical, surgical, and then other specialisms within the nursing general area. The general nursing placements, as I said, will be predominantly done in the Letterkenny University Hospital and also the community. Psychiatry, some very exciting modules there, as you can see, some core to general, but these are the different ones, specialist to psychiatry. Complex needs and mental health, you do pharmacology and mental health nursing, there's mental health and care and recovery, and also psychology and sociology. Intellectual disability will also have very specialist modules. An example of those different to general and psychiatry would be genetics and healthcare relevant to the intellectual disability client, and also health needs and interventions in the intellectual disability nursing setting. There's an emphasis on positive approaches, dealing with behaviours of concern, dealing with clients with intellectual disability who fall into the category of ageing and caring, and also then fundamental and specialist skills. So that's given you just an overview of our 3 programs, an overview of the placements, an overview of the modules. But why would you or should you choose nursing here at Letterkenny Institute of Technology? Well, this is just a couple of our unique selling points. We do pride ourselves in having small class sizes. So as we've already identified, we have 31 places in general, we have 32 in psychiatry, we have 20 in intellectual disability. So our lecturers really get to know you as a student for not just the duration of 1 year, but across the 4 years. So we pride ourselves on that small class size ratio and the connectivity that we have with our students throughout the 4 years. We have a very excellent and well-established connection with industry, in this case, the health service executive, but also the private sector and the nursing homes of Ireland and the community hospitals throughout the Northwest and Donegal. We offer excellent progression routes for you as a graduate in specialist practice, including lots of masters. We'll talk about those in a little while. We have state-of-the-art clinical skills labs, simulation equipment, which affords you an absolute perfect opportunity to actually learn in a simulated hospital environment. And that practical learning is absolutely essential. Experienced lecturing staff, as I said, is also a unique selling point. And absolutely the most important thing is we have a 100% employability record for our postgraduates once they qualify. The career opportunities, as I've said, are vast and can be very varied. So a career in clinical specialist nursing, in advanced nursing practice, lots of our graduates go on into nursing management positions, clinical nurse manager positions. Some follow the educational route or indeed research pathways. And as I've also referred to, there's progression routes to other conversion courses in other allied healthcare professions, including medicine, OT, physio, pediatric nursing, and lots of other opportunities. The follow-on courses for our graduates in nursing include a Master's in Advanced Health and Social Care, a Master's in Therapeutic Interventions and Drugs, and we have a new programme that we will be running in collaboration with the consortium IOTs, a Master's in Professional Nursing Practice. There's also lots of postgraduate specialist and master's programmes in other colleges here in Ireland and abroad. There's lifelong opportunities within our department for continuing professional development, including acute medicine, emergency nursing, foundations of ageing and caring. So that's just a very quick overview of the programs that we offer here at the Department of Nursing and Healthcare. It's been a pleasure giving an overview of those. and we hope to see and hear from you in the very near future. Thank you.